Thank you, Kelsey. So Dr. Handler is the director of the Center for Excellence in Maternal and Child Health and a professor in the Community Health Sciences Division of the UIC School of Public Health. Dr. Handler's research career reflects her longstanding commitment to reducing disparities and improving the health of women, children, and families. Her specific interest is the exploration of factors that increase the risk for disparities in adverse pregnancy outcomes and examining ways in which the healthcare delivery system, particularly how prenatal care, postpartum care, and preconception well woman care can ameliorate these risks and reduce disparities and inequities. Other research and teaching interests include maternal and child health advocacy and policy, building the analytic capacity of the MCH workforce, and the structure of and functioning of the public health delivery system. She is also the PI of the evaluation of the Illinois Breast Cancer and Cervical Cancer Program, and is working on a number of projects focused on the delivery of women's healthcare in the postpartum period. She is also a co-PI of the newly funded HRSA grant, Innovations to Improve Maternal Outcomes in Illinois. Dr. Handler is a former member of the Secretary's Advisory Committee on Infant Mortality, and she's also a nationally renowned leader in maternal and child health advocacy, policy, epidemiology, and public health system improvement. What a great introduction, Dr. Handler. I think some of our students are a little bit familiar with your work and some are new. So it's great to have you, and I'll turn it over to you as we talk about advocating to policymakers this week.
Well, thank you so much, Alexis, for having me. I'm going to share my screen. I looked at the faces. I don't know very many people, so that's always exciting to me. So let's see. Okay, enable screen share. Let me, I have to figure out how to, right. Okay. Oh, host disable participant screen sharing. So that, it's not letting me.
Let me try again now. I just clicked the box.
Ah, okay. It's going to work. It's going to work. Good.
Great.
Great. All right, let me see which one. I want to make sure I have the right one. Okay, I'll tell you in 1 second if I have the right one. One of them had 2 slides that were the same. Okay, well, thank you so much for having me tonight. It's really a pleasure to talk to you. I know this is a wonderful class. I came maybe the first or the second year. That year I talked about reproductive justice and the sort of the history of reproductive justice in Chicago. And that was very fun just to go through sort of all the movements. Chicago is really a rich city in terms of social change movements. And I've been part of the last 35 to 40 years, a number of things happening in Chicago around women's health, pregnant person's health, maternal and child health. And some of that will come out tonight because I tend to have slides with all this stuff and then I end up telling stories. So feel free to interrupt me. I talk very fast, even though I've been in Chicago since 1976, December 30th. I'm very much still a New Yorker, so I talk very quickly. And I'm more than happy if you want to raise your hand, not raise your hand, just interrupt, by putting yourself, unmuting yourself. I won't be able to see the chat questions. So whoever's monitoring that, if you think it's something really important that I should answer right away, just jump in, okay? That's fine with me.
Yeah, that'll be Miss Torres. So
okay, that's great.
Get into the chat there.
Thank you. So tonight we're talking about the policy and advocacy process. I'll tend to use maternal and child health examples. That's sort of my home. And we'll be walking through sort of the whole process related to maternal mortality and postpartum Medicaid expansion as a real clear example of how one does this. I also condensed lots of information from an entire class that I taught for many years, 32 years. I taught maternal and child health policy and advocacy. Now Janine Hill teaches that class for the maternal child health program. Other students are welcome to take it. I designed that class when I was a doctoral student and I just updated it every year and it was really fun. So there's a million ideas here. So if it's overwhelming, it's because there's a lot of things to think about. So policy, what is it? And I think there's not even an agreement on what policy is. So for some, it's literally the action that one takes. It's the course of action where you choose between several different approaches to something and you choose this and that's the policy. some folks really believe that policy is sort of the underlying assumptions and the guiding principles that really help in making decisions about which programs, policies, systems changes to go forward. So there's not complete agreement on this, but I think it's easier for students to think about it as a thing, the course of action, what's really being done. And so that's, we'll hang on to that tonight as our little way to just sort of get us through these slides so we understand them as a group. And I just want to say that policy itself comes in all shapes and sizes. So it could be in the form of legislation. I think we tend to think of it that way, but it very well could be how we implement legislation, or it could be some judicial action. And I think we hear a lot about that in the news right now. The Supreme Court's, about to gut the Voting Rights Act for the second time. And then programs. Sometimes programs are so ubiquitous and so omnipresent that we even consider them a policy. So we might say that the Medicaid program is our policy about how we address healthcare insurance for low-income persons in this country. So somebody might say, well, no, it's just a program, but I would go so far as to say it's our policy strategy. And the same thing, we might say that the Healthy Start program, which is really the only national infant mortality program we have, we could call that a program, or we could say, well, that's our policy approach to addressing infant mortality. So sometimes programs are of such a nature that we elevate them. They're really our strategy for addressing a problem. They may not be sufficient, they may not be large enough, they may not have enough resources, but this may be what all we're doing to address X, Y, or Z problem. So I'm going to talk tonight a little bit about the formal policy process, but mostly about the informal policy process. The formal policy process is more about how a bill becomes a law. I think what's much more interesting is how a social phenomenon becomes a social problem and then becomes something that we get to move from our heads to action. And that's
Dr. Handler, I had a question. Are you gonna, did you want the presentation this way or did you want to put it in slideshow mode?
Oh, I never put it in slideshow mode because I have it, what, is it too small? Because I have sometimes trouble moving the cursor when I do that, but I could think I can use, I can try.
No, you don't have to. I just wondered if you had wanted to do it. I can still see it fine. I don't know about other students. They can kind of.
What do people think? I'm happy to do whatever. And I think I can move it from my keyboard. When I go into slideshow mode, it gets so big that I like, where's the cursor?
Oh, well then just do what's more convenient for you. Yeah, a lot of people said that was fine. It works for them. Okay. Yeah, definitely.
All right.
Sorry, just wanted to check in. I just wanted to ask just for clarification.
Okay. So the way we're going to talk about policy tonight is really about, the combination of both the evidence and the political will to make a difference. And so here I'm going to show you a very simple diagram put together by Julius Richmond, who was our Surgeon General way back in the day, and a friend and colleague of mine, Milton Kovalchuk. And they talk very simply that in order to have any kind of public policy made, we need to have a knowledge base. We need to be able to turn that knowledge base into some sort of social strategy, and then the political will to make a difference. So we need to know that income is super important. We need to know that we can turn that into a strategy called raising the minimum wage, and then we know we don't have the political will to make it happen, right? So we might have the knowledge, the social strategy, but if we don't have the political will, it's not going to happen. And so my friend Kay Johnson came up with this little formula over here, this little grid, which I really like, where she says, okay, if you don't have the evidence and you don't have any political will, you're certainly not going to get a policy. If you've got the political will and you've got the evidence, theoretically, this should be good policy. When you don't have evidence and you have political will, you're going to end up with bad policy. And if you have no political will and you have evidence, again, you'll have no policy. Any examples of no evidence, but a lot of political will where we end up with bad policy? Anything you can think of? From your own experiences, from your own work?
The student said the war on drugs.
The war on drugs. Okay, so there was not sufficient evidence that incarcerating people for drugs was going to stop drug use, but there was lots of political will and a lot of what do I want to say, demonization of people. And yes, we ended up with bad policy, and we ended up with, 3 strikes you're out and maximum sentences and all of that. And we also did the same thing, with crack cocaine, as we know. That's a great example.
Yeah. Another one was abstinence only education.
Yeah, that was the one I was going to use. All right. Was that Sarah? I'm guessing it was Sarah. Was it?
It was Seth.
Oh, okay. I thought
Seth Quam. Yeah.
Okay. So yeah, so exactly. So with, we know that sex education is what really gets people to know about their bodies and to, protect themselves when they have sex. And we also know that for a long time, and it's still continuing, we've had abstinence education as a lack of a non-evidence-based intervention with a lot of political will behind it, which has ended up with bad policy. So that's exactly the example I typically use. So thank you very much, Seth.
Another one said negative policy or refusal to impose mask mandates.
Okay, so yes, right. So we have good evidence that masks make a difference, but we don't have the political will, right?
Mm-hmm.
Implement that, as we saw what's happening in both Texas and Mississippi.
Then increasing police budgeting and police reform.
Okay, yes. So all of these are good examples. So we can see that we live in a situation where we're constantly in this dilemma, because there's oftentimes policies are being made without good evidence, and policies that should be made with good evidence are not being made because there's no political will. And so we know, after Sandy Hook, there was no gun reform. After all that's happened in the last year, we're getting a lot of pushback on police reform. So it should be logical, but it isn't. So that's what I'm going to talk about today, sort of this whole process, the informal process of making policy. Thank you for all your great examples, everybody. So we tend to think about policy as having a life. Policies have lives, and you have to initiate. There's an initiation process where we move from a social phenomenon, whatever it may be, becoming a social issue, because there are many things out there that don't get elevated to be important. But every so often something pops through the policy window and that becomes the focal point. There's the process of numbers, just using data to describe the problem and to make the case for the problem. And then there's this whole idea of selecting alternatives. And then we implement what we select, and then we evaluate and we terminate. This makes it seem like it's all very neat. It's not neat at all, but it does help us think about sort of the life cycle of policies. And I'll talk a little bit about the non-neatness in each of these steps. So this step, how a social phenomenon becomes a social problem, is probably the thing I'm most interested in. I've always been, as a political person, this is what I gravitate to, like, why is this being elevated now? Like what makes this sexy when 10 years ago, this was not an important problem? And we'll talk about that later in terms of maternal health. Why maternal health when, for years we didn't focus on maternal health and only infant health. So it's not always obvious as to which problems are going to merge at any one point in time. And sometimes when a problem does emerge, it's a very acceptable version of the problem. So we might be wanting to address poverty, but we might end up saying teen pregnancy is the problem, as opposed to poverty or health equity or social justice, right? We sometimes get, maybe not us, but the version of the problem that we see in the media and with our representatives in Congress and at the state level, at the city level, they sanitize the problem. So they might take a problem such as, lack of income, translate that into a problem that's threatening to the powers that be, like teen pregnancy, and then our poverty problem becomes a teen pregnancy problem as opposed to an income problem. So that whole thing is a very fascinating process to watch. And why that's important is how you define the problem is going to very much affect how you shape the solution. And so there's an agenda building model called the Kingdon Agenda Building Model. And I'm raising this now and walking us through it because later on I will show you an example in the maternal mortality space related to how a social phenomenon became a social problem. And Kingdon talks about 3 streams: a problem stream, a political stream, and a policy stream. So the problem stream is the why a social phenomenon becomes a social problem. And he talks about the fact that sometimes it has to do with regularly measured indicators. And that's why we have surveillance, and that's why we have Healthy People 2020 and Healthy People 2030 and the City of Chicago 2.0 and 3.0, because those indicators, we use them to create a firestorm around an issue. Sometimes it's about a focusing event, which draws attention to the problem. And we'll see later with maternal health how many major focusing events there were with people who died or got close to dying who shouldn't have, and who were not the usual suspects, and how those became focusing events. Sometimes it's a policymaker who's affected by a problem. So sometimes you find very unusual bedfellows with certain policies because a person was personally affected by a problem. So even though they are a very conservative lawmaker, they might be very interested in something because someone in their family experienced a rape, for example. And so someone who you might not expect to be pro reproductive justice might come out in support of access to abortion because someone in their family was raped. So sometimes how policies get made, very unlikely partners sometimes come together to make this social phenomenon the problem that individuals focus on and society focuses on. Kingdon also talks about that there are often, you have this problem that's emerging, but if you don't have someone to sort of guide it through the system, it's not going to go anywhere. And so there's this idea of there's a policy stream. You've got to get into that stream. You've got to get in your canoe and go down that stream and have policy proposals. And sometimes, you wonder like, why am I working for this think tank? I've been here forever. Our ideas are never going anywhere. Well, I have been talking about children's allowances since I began teaching that policy and advocacy course. And I probably learned about them when I was a master's student in 1980. And I've been to meetings where, they ask you, what is your fantasy policy change that you want? And I'm always like putting up on the board, national children's allowance, just like Canada and the rest of Western Europe and New Zealand and Australia. And, all of a sudden, oh my goodness, it's being discussed in our Congress. And, it's unclear what will happen. And there's a lot of pushback, but even Romney has come out for a children's allowance. So you just don't know. All of a sudden, this idea that you've been plugging away and plugging away and plugging away, all of a sudden, there's somebody who lifts it up and moves it into the policy stream. And that's usually what we call like a policy entrepreneur or a bunch of entrepreneurs who have moved this forward. And, interestingly enough, I'm in a lot of MCH spaces and, we are constantly discussing, social justice, health equity, racism. And I've been in time after time again, I say we have to also talk about income and classism. And, it's taken a really long time to have folks acknowledge that poverty is so fundamental to so many problems in this country, and it's intertwined. Classism and racism are really intersecting in this country. So Kingdon also talks about the policy stream then intersecting with the political stream. And so what else is going on? What's the mood of the country? What are the election results? We now have a new administration. So all of a sudden, all kinds of policies are being promulgated and floated, and hopefully will get passed in this 2-year window that we have. And, just changes of administration, changes in ideology, partisanship in Congress, pressure campaign from interest groups, all of those things are part of the political stream. So you've got the problem stream, then the policy stream, and then the political stream. And, I could have created this, I wouldn't have called it this, but that's sort of like the whole idea of how a policy makes its way through the cycle. But I really like this idea of these 3 streams coming together. So we all tend to talk about Kingdon, and it's a well-used model. Kingdon also says that these policy windows that come about, they tend to open up for short periods of time, usually from a confluence of circumstances. There might be something that's pushing from the right and from the left. Even if you would think about criminal justice reform, during the Trump administration, there were, major proposals related to criminal justice reform coming from the Koch brothers and from, criminal justice reform advocates from the left. So just weird things happen. And when those kind of like the right and the left get together, sometimes policy windows open up. And you often, in those cases, you're not necessarily going to get the most radical version, right, of the policy change, because all of a sudden you've got these policy entrepreneurs coming at it from different perspectives. And so whatever is going to get shaped typically is some kind of compromise, and usually often progressives are left disappointed because they don't get exactly what they want, but they've pushed open this window and they've pushed this further than it's been before. So sometimes these policy solutions, they sit on the back burner for a long time, and then the time is right, you have to like be ready. And I think that's really important. So if you are ending up, you leave your master's or your doctoral program and you end up going to work for a think tank, and you're sitting at the Center for Budget and Policy Priorities, and you're cranking out every day amazing documents about how, earned income tax credit does this and the child tax credit does that. And, like every day grinding away, all of a sudden earned income tax credit, child tax credit expansion is in the news. It's hot. All the materials are ready. So you got to be on the ready constantly, for the fight, ready for the fight. And then just finally, the definition of the social problem does shape the solution. And a great example of that is, you could talk about our problem being we have a horrible homelessness problem and homeless families, right? But that's putting the burden on people, the individuals who are the victims, right? As opposed to, we have a terrible housing problem. We have a lack of affordable housing. And so you're going to have two different solutions, right? If you think of the problem as homelessness, you're going to maybe build more shelters, and maybe building more family-friendly shelters, and it'll all be about shelters. If you think of this as an affordable housing problem, you're going to talk about housing and getting people housing. And so how you shape the problem is really going to affect how you shape the solution. So it's really critical. Your words are critical. I'm just going to pause and see if there's any questions or comments. I know I'm talking a lot already.
I've been checking the chat. It's mostly been comments.
Okay. Anything important?
So, well, they were talking about how Romney has 25 grandkids, and Mormons in general tend to have a lot of kids. So this would be one reason why he would latch onto this idea and support it, because of his own, like you mentioned earlier, like this personal investment in this kind of thing for him. And
yeah, interesting. I hadn't thought about that. That's an interesting point. They're probably not in poverty, but I think that it makes you sensitive to the needs of children. I mean, a lot of our legislators, are very far removed, and we have an aging country run by white men, and we have a growing population of young children of color, and there's a huge conflict between those two. So here I just give an example of infant mortality as a social problem, how it kind of merged in the 80s during Reaganism from actually a hands-off approach by the federal government on maternal and child health programs, and out of that came a lot of focus on infants, because infants are sexy. And even the Southern governors got involved. And then we went from that to Bush trying to get community engagement and support. This is the first Bush. And one of his strategies was to have these community-based programs, and that's how Healthy Start emerged. And then over time, through Obama, we moved into this this understanding of social determinants of health and structural determinants of health related to infant mortality really being seen as a symbol of our society's ability to feed and clothe and house people. And it's really become much more of a health equity issue. In the last 4 or 5 years, we've focused a lot more on maternal health. And just recently, again, with a lot of push, there's more of a link. People trying to say, there are some people who say, well, we've got to focus on maternal health because we spend all our time talking about babies. Then there are other people who are saying, listen, you cannot talk about these two things as if they're separate. They're totally intertwined. And so the health of the mother is totally related to the health of the infant and vice versa. And we shouldn't be having just maternal mortality programs. It should be maternal and infant mortality issues looked at together with alignment. So I think that's where we're moving to right now. So, okay, so the first part of the Brewer's paradigm was initiation. How does a problem even get on the scene? The second part is estimation, describing the problem in numbers. And it's usually interrelated with initiation. And sometimes it's really the numbers that drove initiation. It's really a chicken and egg phenomenon. Just this part of the policy process is sometimes tricky too, because we often don't have the right data. We might have data that are collected through a certain paradigm, which leads us to defining the problem in like a deficit way as opposed to an asset way. And we also know that data alone are not sufficient. Also, the other thing to say in this very neat little steps of Brewer, yes, estimation is the second step, but you have to keep collecting data throughout the life cycle of a problem and its solutions. So this step doesn't end. Then in the next sort of neat way that Brewer describes it, okay, problems decided, we've got the numbers, now we've got to figure out which alternatives, what are we going to do? How are we going to address this problem? And this sometimes gets tough. And I think, in teaching the policy and advocacy class, students tend to want to talk about programs at the individual level. And I really push them. Okay, so you want to have increased father engagement. Do you want to, in maternal and child health programs? Well, there's ways to do that at the policy level, not just at the program level. And I think it's also hard sometimes even for policymakers. Well, what else has been done? So recently I went to a presentation on OB deserts for the Perinatal Advisory Committee of the state. And the way that the state was handling this is they had someone research what other states were doing about OB deserts. So often you get the ideas from other states, other cities, other places where it's been tried, sometimes other countries. But again, in this step, there's always politics. Who's promoting which alternative? How do we get to the final? Is it a compromise? And what criteria were used to make the decision? I think we can all think about, all the ways we got to the Affordable Care Act. We were trying so hard to have expansion of health insurance, and there was a Medicaid for option, public option on the table that was nixed. And then eventually, to get support supposedly from Republicans, Obama went with the Affordable Care Act approach, which was to have marketplace plans. And, the second he puts that out there, it was the Republican idea. Democrats voted for it. Republicans didn't vote for it. And they tried to trash it ever since, even though it was their idea. The Medicaid expansion part of that was not their idea, and they nixed that in the Supreme Court. One thing about selection of alternatives is that us as public health professionals, we have a role to play in that we can generate ideas. We can, as part of our research, we could be generating the evidence, and that evidence could be wound eventually, if there's lots of evidence in support of an idea, that can be part of the background documents that lead to the selection of an alternative. So there is an idea vacuum out there, and we have a lot of opportunity to play a role in filling that vacuum. Then in terms of the next step, so we initiated, we got numbers, we selected, we're going to go for it, policies adopted. Okay, then it's got to get implemented. Oh, you think your job is done? Well, you know what? Implementation is a big mess, as you know. Things have a lot of problems being implemented. And who implements, let's say, new legislation really affects how things are delivered. So, and the rules that get written, and the ways that different politicians and political views come to play in implementation is very important. So, how regulations are written, how long they take to drag out implementing something that maybe that administration doesn't want to do, who controls it, where's the money lie, who's financing it, maybe it's authorized but not appropriated, maybe they give no money for this. And this brings up the whole important point that even if your policy is adopted, you don't give up. You have to be involved in monitoring its whole implementation process. And then evaluation, and that's a very critical step, and it's a feedback loop. So as programs and policies are adopted, you see if they're working and you feed back to reform policies and make changes. And this is also a continuous process. Finally, sometimes policies are ended, and why they're ended is usually much less about the problem being solved and much more about politics. And a good example of this is we ended cash assistance in 1996. So from 1935 to 1996, we had aid to families with dependent children. It was earlier called aid to dependent children. It was expanded in 1950 to aid to families to dependent children. And there was a big sense that, being on cash assistance didn't give people incentives to work and was causing poverty, as opposed to people were using cash assistance as a safety net. So we actually terminated this program, but we didn't terminate poverty. And when people say, well, you know, TANF became AFDC became TANF, Temporary Assistance for Needy Families. And so what they were trying to do was get people off the rolls. And if you see the data, yeah, they slashed the rolls. People are no longer on cash assistance. And in fact, the TANF dollars in most states are not even used to help poor people per se. But we still have poverty. And not only do we have poverty, we have growing poverty and we have growing income inequality. So we solved no problem except getting people off welfare rolls. And so because the problem was defined as the welfare state is the problem, not poverty is the problem, the solution was very draconian. And it happens rarely. In my lifetime, I feel like this is one of the major programs that I've seen terminated. Then there's always this question of, you know, what is the legitimate life of a program? And should we be, you know, we should always be thinking through how to reinvent ourselves and do better. But what happens is you often get constituencies that support that particular policy or program. And so it gets really hard to make changes. In the case of cash assistance, poor people don't have a lot of power in this country. And so it was easy for a Democratic president, Bill Clinton, to do this. Felt very guilty after he did it. And so he passed in 1997, the Children's Health Insurance Program. So poor kids would not have health care. But it was a major, major policy change in this country. So any questions about that informal process? Okay, I want to talk just a little bit about the formal process. I don't want to go through the whole bill becomes law, but I just want to say that in our country, we have a federal system. And that means that there's a federal government and the government divides its power between the feds and subdivisions, whether those be states to counties, cities, and the powers of the federal government are very limited. And that is why you have, you know, this in the Supreme Court, you have these debates because there are some who say, well, the federal powers are very limited and they're the strict constitutionalists. And then you have those who say, you know, the Constitution should be a living document and we need to update it and the world has changed and we can't live like we're in 1776 or whatever. Importantly, health is not mentioned in the Constitution as a function of the national government. And there's separation. Not only do we have a federalist system, right, where we have federal government and then these other branches below, other units below, we also have this separation of powers. So we have three branches of government: legislative, executive, and judicial. And if you're thinking about why it's so difficult to make policy change in this country, we're so fragmented. So we have these separation of powers at every level of government, and we have all these levels of government. And so when policy change does occur, typically the change is incremental in this country. So how do you figure out like what to do? You know, like how you really want to change something in the area that you're interested in, whether that be criminal justice reform or food deserts or OB deserts or just general, you know, income distribution issues, income, you know, economic equity. And typically we think about policy instruments as having sort of three different types. There's information you can provide, you can educate. So some policy instruments are just about providing information. Some policy instruments are used or provide incentives to do things, get people to do things, and some policy instruments regulate. They get people to do things by, it's more of a stick, whereas the incentives are more of a carrot. And, you know, regulations is probably the one that we think about the most, but there are approaches of using incentives to coax behavior, to coax change. And so I'm going to get, that's the sort of the general framework for policy instruments. And then I'm going to just talk about public policy instruments, because that's what we're really talking about in this class. And these are the instruments that governments use to make social, political, and economic change. And there are many public policy instruments out there. And you hear about them in the news. I'm not sure you always think about them as policy instruments, but taxes, all this talk about taxes, raising taxes, lowering taxes, cutting taxes, tax credits, all that, that's all public policy. Regulations, giving subsidies, providing services, changing an agency's budget, changing an appropriation, changing rights, changing economic activity, consultation, financing, bureaucratic and political reforms. Governments do all these things, education. All of these can be turned into public policy instruments because the government actually is involved in all of these spheres. So whatever sphere the government's involved in, we can approach and try to make a change and make something happen. So how do we choose and how do policy instruments get selected? It really depends on a lot of what I said earlier, the whole policy process, and also the historical factors that are operating at the time, the social, political, and economic factors that are operating at the time, what the government is doing, who's in charge, who's in control, and all cultural and ideological phenomena that are happening at that time. And we have a particularly unusual situation in our country right now because we have huge clashes in ideology in terms of, progressive movements and right-wing movements, both being elevated simultaneously. It's a very strange time that we're living in. So when we choose a policy instrument, when we go forth and decide this is what we're going to, advocate for, we want this to change, we want this to be the way we're going to do it, you have to think, whatever I'm coming up with, is it going to pass muster? Is it going to be legal? Is it going to make its way through the courts and end up at the Supreme Court? And they're going to say yes. And I think people don't quite understand. So whatever, you say, okay, voting rights. So Georgia and all these states are trying to turn back voting rights and prevent, people from having access to mail-in ballots, Sunday balloting, Sunday voting, drop boxes, et cetera. And you think, okay, well, why can't Congress just overturn that? So now Congress, the House passed HR 1 yesterday. They do have a bill to address all these issues. Who knows if it'll make it through the Senate? Probably not without getting rid of the filibuster. And whatever happens, even if that gets passed, it's going to get challenged. The entire judicial system is about trying to figure out does this set of laws pass muster with the Constitution? So somebody's going to, somebody in Texas, that law gets passed is going to, file a suit. The law is going to be in, there's going to be an injunction, and then there's going to be a stay of injunction. It's going to go up make its way through district courts, appellate courts, to Supreme Court. So it's like when you think about the choice that you make, you have to think, is it going to pass muster in the legal system that we have? And right now we have a very, we're starting to have a very lopsided legal system in terms of who's running it. And we know in the Supreme Court now, in terms of 6 justices. So it's really, you have to think this through. How can I get this through the system and it's going to pass a Supreme Court test? You also have to think about, is this something that I come up with that is reasonable within the terms of a government-citizen relationship? If this is something where there's a lot of punishment or coercion, it's probably not going to pass muster. Also stigma, if there's a lot of stigma, it will, might make it out the gate, but somebody's going to challenge it. And how will people view this? Is this going to be viewed as legitimate? Are people going to say this is something that's, just a giveaway? Or are people going to say, oh, everybody's getting this. This is a good thing. Oh, all children get this allowance. Oh, this is not bad. This is not just a blue state versus red state, kind of project. And the policy instrument really has to be seen as just and lawful in the eyes of all those involved. So the kinds of policy instruments that are out there are economic policy instruments, like there are grants, and we call them in-cash instruments. We can charge, we can place charges. We want something to happen, we can add additional fees. We can, right now we're working on something where we're trying to unbundle the postpartum visit from prenatal care and labor and delivery. So we're working on trying to figure out the billing mechanism with Medicaid to change the way the billing happens, which will then change behavior. So that's a policy change. It's very kind of like, you think, oh my God, that's like an obscure policy change, but no, the overall change is the unbundling, and then you have to figure out how to do it. And so in that case, it might just be changing a reimbursement. Certainly the government can provide goods, can come, to communities and literally deliver services and provide free vaccines, respond to a hurricane, those are policy instruments as well. And then in terms of cash, I'm not going to go into this because we're running out of time, but there's various kinds of cash instruments. You can give money directly. You can give grants to small entities who then in turn take care of people. You can subsidize individuals or businesses to do something that you want done. You can give reduced interest loans. You can give loan guarantees so that people can borrow, so that they can build capital, social capital. You can charge fees. You can make tariffs. All of these are cash instruments. They're all policy instruments. I want to talk a little bit more about taxes because it's so much in the news and people don't think of it this way, but how we get money from people and how we give it back to people is so much public policy. It's like the most fundamental part of public policy in some ways. And we tend to give, tax exemptions to actually very wealthy people. And when we get into these debates and fights about welfare, well, we always have to say back, what's the corporate welfare that we're giving? And, we're just trying to give people cash assistance compared to the volumes of tax exemptions that big corporations have. It's just, nothing in comparison. Tax write-offs and also tax credits. Now you're going to hear a lot more about tax credits right now because there is a refundable child tax credit passing through the bill, the omnibus bill, that reconciliation bill that is for CARES, for COVID relief. It's trying to be passed right now. If the House is in the Senate. And this is where there's a proposal on the table to give families $3,000 for kids under 6, $3,600, every kid in the family universally. And this is the beginning of this idea of a children's allowance. Senator Romney is saying, go beyond this and make this permanent. So here we're in this debate, but the fact that you could, that we're talking about this, I want you to understand this child tax credit, if you don't pay enough taxes, right now it's not refundable. So it's really only for working poor. If you make it refundable, you don't even have to have the tax bill. You can still get the credit. And that's the difference between a refundable and a not refundable tax credit. And it's really important. We want tax credits that are refundable. If you don't have enough money, don't make enough money to pay taxes, you'll still get the benefit. So if you hear people talk about some states have the earned income tax credit that isn't refundable, you want to fight for a refundable earned income tax credit. Right now, we're trying to push for a refundable child tax credit in the bill that's making its way through Congress. And then we know about tax cuts. And tax cuts basically starve the budgets of the government and give money to businesses, theoretically, to fuel the engine of the economy. But when the government is starved and people can't rely on the government because it can't do its job, then you get disillusion with government. And that's what you're seeing right now. Over the last 20 years or so, 25 years, we've really devolved the government. We've been starving the beast. And that's how, if you go back to like Heritage Foundation documents, the agenda, drain the swamp, starve the beast, all this is to take the government, devolve it so that it doesn't have the ability to respond. And when it can't respond, then people say, we don't want the government involved because they can't do anything. And then there's this whole sort of anti-government stance that takes place. And that's what we're witnessing right now. Okay. Also, just in terms of how we structure our taxes, you can have the tax system be progressive, regressive, and really, you can say at what income should families start to pay taxes. That can be changed. You can talk about how you're taking taxes. Everybody gets the same amount taken. That's a flat tax, and that's really a proportional tax is very regressive because the percentage for a poor person takes so much more out of their income than a percentage for a rich person. So the most progressive way to do taxes is to tax people according to their wealth and their assets and not let people hide their assets. Okay, so that's just my spiel because I don't know what you had some homework and I don't know what you've been thinking about, but those are the kinds of things. I mean, we tend not to think about taxes that much and cash instruments, but those are substantial policy instruments that you can use in any of the sectors that you're interested in working in. So how do we go from, figuring out our policy instrument to making it reality? But we have to engage in advocacy. And the advocacy process is a process of really deciding the problem that we're going to focus on at that time. Usually a group of people come together, advocates, they may be an organization that has an official structure, it may not even be official. And you have to think about why you're picking this problem, and is it for strategic reasons or because there's really a widespread feeling about it from everybody. We got to do something about this now. And you got to think about also strategically, is there a policy window opening up right now? Is there something on the horizon where if we focus on this, this is a great time? So like eliminating cash bail was a very opportune time after everything that's happened in the past year, plus, you know, sort of an overall sentiment in the country, even from the right, that we have to do something about justice reform. And usually you decide the problem you're focusing on, you collect and review data, you get the information from all kinds of places. It could actually be from doing surveys, it can be anecdotal, it can be from scrutinizing budgets of agencies to see what's already out there. You might have to do a Freedom of Information Act to get agency information so you can see what they're really spending their money on. Sometimes you talk to insiders to see, maybe you get a disaffected person who'll give you the real skinny about what's going on. Sometimes you go to the peer review literature, but usually it's so far behind that things have moved. Someone, you know how long it takes to get an article published. Those of you who haven't done it, it's like sometimes a year, could be more. And sometimes you work with other advocates or talk to other advocates about, how to frame this, which way to go.
So before you go more in depth, we actually had a few comments. So Seth had said, I'm glad you brought up when you were talking about the Affordable Care Act. And I've been wondering why the administration didn't go for a more progressive policy if none of the Republicans are going to vote for the compromise anyway. And then Zoe said, Scalia, which I'm probably mispronouncing, sorry, called himself a faint-hearted originalist, so didn't even, go full on, let's go with the founders meant, even though he's branded as a significant originalist, which has always made me skeptical of originalism. And then Amy said,
Scalia. Okay,
yeah.
I wasn't
and then Amy had a question. The judiciary plays such a key role in policy. Is there a way to conduct advocacy work within the judicial system? Some judges are elected, some are appointed, and there are huge issues with vacancies not being filled during Democratic administrations.
Yeah, there's definitely, just in response to Amy, you could say how organized the Republicans were during the Trump administration. And, they didn't do any legislation during that whole time. All they did was appoint judges. So Democrats have not been organized on this issue at all. They're going to try to do better. They know they have 2 years, so they have to get things moving in as many appointments through as possible. Obama, he did not understand in some ways. He understood, but he was under so much pressure, I think, and so many things he was trying to get done, and he was damned if he did, damned if he didn't kind of situation. He, wasn't taken seriously enough. And I think that the Republicans have done a much better job of mobilizing voters around issues than the Democrats have done. And I do think there's, lots of opportunity to do advocacy around judicial nominees, appointments, et cetera. And, when you go to vote for judges, every election, right? Do you know who you're, I go in there with my IVI-IPO and my progressive this, my program. I have no idea what's going, they give you like 50 people to vote for. None really know who we're voting for. There was finally, like occasionally there's one or two that people say has to go out, and you really tell everybody about that one or two people per person. But for the most part, we don't really know who we're voting for in terms of judges. I think it's a really good point.
I actually know that there's a few guides that actually do what they do in terms, especially in terms of judges, is they'll say, okay, this, like, they kind of simplify, like, this is what this person advocates for. This is what they've said. This is what they have voted for in the past if they were in other positions of power. But you do definitely have to seek those out to kind of see. It definitely is. It's not easy. And there are always so many
judges. It is not easy. Who was talking? I can't figure it out. Like, who was speaking?
Besides me, it's Washika. Sorry, let me turn my video
off. Oh, you're
off.
talking. I couldn't see. Okay, no, okay.
Sorry, I turned my video off because my computer was really slow.
Sometimes you can see the yellow box highlighted, but I couldn't see, okay.
And so then Zoe asked, to add to that, does it make sense to advocate for certain judges to be elected or appointed more or less?
I really don't, I don't have a well thought out response on this one. I have not really given a lot of thought to like what the best way, election versus appointment. And So I'm not the best person to answer. Maybe another student has thought about this more, but I really feel like, getting someone like Stephanie Altman from the Shriver Center, she would have a good sense of this. I don't know what is, politically, what gets you the best bang for your buck in terms of moving progressive agenda forward. I am not sure. But I just think the way we do things is not good. And, and the fact that the Supreme Court doesn't have to be 9. I mean, it could be another number, but the minute the Democrats try to move anything forward, I mean, they get slammed in a way that Republicans never get slammed. It's just crazy.
Okay, and then Natalia, sorry, long day. Should the preferred policy instrument determine how to determine the problem, or should the problem guide what instrument to adopt?
Well, so first you want to make sure you've got the right problem, and then selecting the instrument really has to do with that's strategic, because sometimes you have, like, for example, you could say that universal healthcare, a single payer system is really the goal, right? But a strategy along the way might be a Medicaid option, public buy-in. So you think that politically you're not going to be able to get, universal care, single payer system in this country. It's so much right-wing propaganda, you immediately get to death panels, et cetera. But you could possibly get, along the way, the Medicaid buy-in. And so maybe, public option buy-in. That might be a strategy that Biden tries to go for example. So sometimes you have to think through what's politically palatable, what's feasible, what's going to pass muster. I mean, even the Affordable Care Act, the Medicaid expansion got nixed at the Supreme Court. Yeah. That seems like a no-brainer, right? That was a great thing, and states don't have to do it. And that got to do with this whole federal state tension. And at various times, we look to the federal government to solutions. And when I would say more right-wing ideology is prominent, we say it's states' rights. During the 60s, we relied on the federal government to get the Mississippi and Alabama and Louisiana to stop killing people. And stepped in, they sent their National Guard and they sent their marshals, and they put clinics in those places and said, enough, we're not going through the states anymore. Feds right to the cities and the communities. We're bypassing these ridiculous states. So there's this endless tension in this country between feds and the states. And right now we're still in a very much states' rights kind of moment, I would say. And the power of the federal government is, it's been devolved, it's disparaged. And the people who disparage it, they're serving. I would say, how do you have the nerve to serve? You don't believe in government. What are you doing there? What are you doing there? You don't even believe in government and its role. So there's lots to talk about. I'm going to probably have to go to 7. I'm just telling you, but I will try to, we don't have to get to the exercise if we want to these chats are great. I'm cool with whatever.
Yeah. So I think there's 2 more questions. So I think this one was slightly more of a comment. So Zoe said, I think sometimes we're often asked if we want to retain judges or not. I don't remember. I was coerced into voting in the last election, so I don't really remember that part. And that may or may not be true. Someone else can answer in the chat. And then Brandy asked, how useful is it to participate in email campaigns or petitions?
Well, I do think, it's a good question, and we'll get there a little bit later maybe, but that's the way we do things now, right? And so, legislators do count, their staff do count the number of emails. Now, they also, they more inclined to look at a personal letter than a form, but they also know that does represent, they have a sense that might represent a lot of people. Now, it could be that, we have these bots or whatever that send these things out, but that's the way people communicate now. So I think it is informative. The other thing I want to say is that state government, it does make a difference to file witness slips. So you don't have to actually go, but once, 3 weeks ago on a Saturday, I knew that there was a Medicaid reimbursement for doulas bill coming up, and I got an email at 10:30. They're doing it right now at 11. Can you file a witness slip? So, you just send in a witness slip saying you support the bill, and your legislator gets that, and that person's on the fence. All of a sudden, a whole bunch of people on a Saturday morning are filing witness slips in support of Medicaid reimbursement for doulas. That might say something. So I think it is valuable. And it makes me feel better anyway. I do feel better when I do it.
I've done some actually as well, and I actually put an FAQ for it's from the ACLU. It's the first one I found about witness slips for Illinois. So if some students have questions about how that process or what that means, you can just look there. So yeah.
Oh, thank you. Thank you for doing that. Okay, so then I do think it is important to, whatever issue you come up with, to frame it on your own terms. So you might be in a situation where you're going forward with, let's say you said, okay, we're just going to put, our instrument is public option Medicaid, expansion for the public option. But you might say, well, we're still fighting for a single payer system. So you're framing the issue as, this is what our vision is, but this is what we're going for now. And some other person might just say, no, I'm not going to go for a single payer system. I'm just going to join with you because I believe in the public option. So, but it's good if you as an advocate and your partners and people you're working with, if you can lay out your vision, because it also helps you know where you're going and the context of what you're trying to do. Then there's a whole process of educating the public and key stakeholders, getting involved with social media, the regular media, et cetera. And you also want to, of course, find out who has the power to make a difference. So I think sometimes folks end up talking to themselves, and you really need to make sure that you're talking to the right people in the right rooms, whether that be the bureaucrats or the legislators, could be the governor's office, who's really got the power. That's just a little picture of, trying to make sure that you're targeting the right decision makers. And sometimes, media is very useful in helping you do that. And know your allies and know who your opponents are. So one mistake that folks often make is they go to Springfield, they've got this great idea, and they get there and like, well, Illinois State Medical Society says, it's a no-go, it's a no-go. So you have to know ahead of time, this is gonna be really controversial. How do we address this? So right now, so in 2007 or 8, the Alternative Healthcare Delivery Act passed, which allowed for 10 birthing centers in Illinois. And there was a working group that came out of Health and Medicine Policy Research Group, which is the Birth Center Task Force. And really that group got this legislation, but we've only have 2, now we'll have probably ultimately 4 birth centers. And the way the legislation was written, it's so laborious in terms of, only 1 birth center in this county has to have a hospital and all these rules and regulations. And so there's been this move afoot, to try to figure out, okay, there's now a huge OB desert on the south side that's become really prominent because of COVID. St. Bernard's closed its OB unit, and there's a move afoot to try to get birth center legislation going because people want to open a birth center on the south side. And, the Birth Center Task Force is reinvigorated, and, it's very interesting. We're sitting there politically trying to figure out how to do this. So there's a tweak, what we call the tweak bill, which would allow to expand the number of demonstrations from 10 to 11. So the Southside Birth Center can happen in the original bill. And then there's a whole new bill. But as we're formulating this new bill, people are going, okay, that one's really going to get opposed by the State Medical Society. Okay, how about if we put in X? If we put in X and they come back with Z, we'll get Y. I mean, there's all this strategy going on around literally line by line of this bill to try to figure out who our opponents are, what they're going to say, what we're going to compromise on. If we say 10 and they say 2, we'll get 6. So, I mean, it's just amazing to watch this process going on. And then also, of course, you eventually you develop your recommendations and you decide whether you're going for a legislative change, an administrative change, working with bureaucrats, or doing legal advocacy. And in terms of getting your stuff together, you become the expert, you have fact sheets, and you provide comments, you provide testimony. And testimony doesn't just mean legislative testimony. You can go to advisory boards, school boards, regulatory committees. You can do any of those. You also publicize the issue as much as possible. And these days, a lot of that's social media. In the old days, we used to have press conferences and, put out press releases. In very old days, we used to do things like form a speakers bureau and come up with a talk and try to go to as many places as possible. A lot of that's really changed in how one does advocacy. And of course, you bring the issue to those who have the power, but you also form coalitions, you organize in the community. And this is not the same thing as community organizing. I think community organizing, in my mind, is a bottom-up strategy, which is, very much about empowerment. This has empowerment potential, but it's more of a top down, right? Because the advocates have come up with a solution and a policy strategy. Then they come back to the community. What would be great is if this was a joint venture of community and advocacy. Typically, advocacy organizations are more likely to be like more professional organizations, even if they're not for profit, as opposed to community organizations. So there is a little bit of a tension, I would say, between true community organizing and sort of this kind of community organizing, unless the community organizing led to advocacy to begin with, which happens also. But sometimes advocacy organizations sort of claim this this kind of activity as opposed to community organizations. And then, of course, you can always threaten litigation or use litigation. You can go beyond bureaucrats and really say, I'm going, forget you, Medicaid department, I'm going to the governor. You can certainly lobby. And as part of lobbying, you can either develop legislation or you can lobby for legislation. And there are rules about lobbying, and I'll tell you about those in a moment. But sometimes you're developing policy and program proposals just for administrators and you're not involved with legislation at all. And sometimes you're just a watchdog and the policy has already been implemented and your main strategy is making sure that it's implemented correctly. Where we had, this was the late 80s, early 90s, there was a Medicaid expansion for pregnant women in the state. And it was passed, but there was no information. No person knew about it. No pregnant person was made aware that, if you made, you didn't have to be a cash assistance recipient to get Medicaid coverage for your pregnancy. And so we had to go to the bureaucrats and get them to make posters and signs. And we spent our time putting them up in laundromats. It was crazy, but the bureaucrats knew that they were going to get federal reimbursement for their Medicaid dollar, but they didn't want to spend the dollar to get the dollar. Even though the expansion was legal in the state, there was nobody telling anybody that they were eligible. So as an advocate, you have to be ready to do that kind of work. I just wanted to say that there's a distinction between advocacy and lobbying, and that you can talk to your legislature, you can make legislation, you can educate the public, et cetera. Lobbying is when you actually ask for specific legislation to be passed, and or reflecting a view on specific legislation. And this really only makes a difference if you're a not-for-profit, because there are rules and regulations about how much lobbying not-for-profits can do. And so this is a whole nother sphere about whether you become a 501, you're a 501c3, and whether you get a 501c3 election and 501c4 and all this other stuff. But there's very strict rules about lobbying. But lobbying itself is really just saying, vote for HB this or vote for HR this, as opposed to I'm educating you about doulas and Medicaid. So it's not considered lobbying when you communicate with legislators and public about a particular issue, but not about specific legislation. If you go to non-legislative bodies, that's not lobbying. Administrative advocacy is not lobbying. Going to the governor's office and mayor's offices, that's not lobbying. If you file it, if you do a lawsuit, that's not lobbying. Developing alternative policy positions, that's not lobbying. And if a legislative committee has requested your testimony about specific legislation, then it's not lobbying because you were asked to come testify. So now I'm going to give you, and now we're doing okay on time. I want to talk a little bit about an advocacy example. So what I want to talk about is the postpartum Medicaid expansion, and how what the life of this is right now. So let me just give you a little bit of background on Medicaid. I don't know how much you should have learned about Medicaid, somewhat in hopefully one of those classes like 403. I don't know, I would hope so. And those of you who take maternal and child health, you hear about it in several of our classes, and probably in HPA you've heard about it. But Medicaid for a long time, until really till 1986, was only really given to people who had cash assistance, AFDC. And then in the 80s, we started to expand Medicaid and have Medicaid become coverage for people not tied to cash assistance, and up and up and up in terms of the level of who gets it. And in addition, we did particular expansions related to coverage for pregnancy, coverage for family planning, and now there's a push for increased expansion for Medicaid coverage for the postpartum period, which is the period after birth. As you also know, there's a Medicaid expansion piece that's part of the Affordable Care Act, adopted in the majority of states, but 14 states don't have it. So I want to use the postpartum Medicaid expansion as an example of how one does advocacy. First of all, we had to decide why did we want a postpartum Medicaid expansion? Well, if you got Medicaid coverage for your pregnancy, you only are eligible for Medicaid coverage post-pregnancy for 60 days. And over time, we were learning that so many of the maternal deaths that were happening in this country are happening in the postpartum period, that families pregnant persons, postpartum persons get kicked off Medicaid 60 days unless they are poor enough to get Medicaid for another reason. So very, 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 very poor people who don't get cash assistance can get Medicaid, but you have to be extremely poor as their insurance. Otherwise, Medicaid insurance is, or now, over time, that was expanded in our state. It's expanded to 138% of the federal poverty level, but that's how it was. And the understanding that the 60-day cutoff was really problematic for those who would not become eligible. They might have had too much income to be part of the Medicaid expansion that was part of the Affordable Care Act. They might not have a sufficient enough income to buy a plan on the marketplace because those plans are expensive and they come with a lot of deductibles and copays. And so you have all these people who get cut off at 60 days, still have health problems, might have chronic conditions, hypertension, obesity, diabetes, et cetera, might have postpartum depression. And all of a sudden we have no coverage for these people because they're above the 138 from the Medicaid expansion. They're not poor enough, poor to get the sort of cash assistance type Medicaid, and they can't afford the marketplace. So we settled on this as one of the many strategies for dealing with maternal health. So in general, why this came about is that over time, women's health was really elevated in the Affordable Care Act, and a lot of attention to getting well woman care started to be part of what was the federal government's effort, and more recognition that we were having increased rates of maternal death in our country. Other countries, maternal mortality was going down. In our country, maternal mortality was going up. The feds started getting involved with, what they called AIM bundles, trying to get hospitals to do better high-risk maternity care, starting to think about not just hospital levels of care related to neonates, but also to women. And then we started to have what we would call these focusing events. So I don't know how many of you know the stories of Kira Johnson, Shalon Irving, and Serena Williams. Most of you, I'm sure, know the Serena story. But Kira Johnson was in 2016, a 39-year-old woman with a 19-month-old son, went in for a routine C-section, and they lacerated her bladder during the C-section. And the family complained, and their complaints were ignored. She was in pain, and they just ignored her, and she died. Then in 2017, Shalon Irving, who worked for the CDC in the Division of Reproductive Health, had a master's degree, a PhD, came home from her delivery, was fine, and it started to have swelling, went back and complained and called and whatever. She ended up dropping dead from postpartum preeclampsia. And just so happened, she was a friend of Lauren Underwood, Representative Lauren Underwood from, they went to Hopkins together. And then you all saw, many of you saw a stunning video of Serena Williams in that HBO series where she's literally having a pulmonary embolism, knows it because she's had them before, and fighting to get attention for that pulmonary embolism. So these were a series of focusing events. Why do I say they're focusing events? When poor Black women were dying, and without these kinds of high-profile events, nobody was paying attention. It took in this country, this racist country, the stories of these women to be elevated because they shouldn't be dying. They're middle class, they're rich, they work at the CDC, they're Serena Williams. So it takes that kind of thing sometimes, unfortunately, in this country. And so then I'm going to talk to you about what the 115th, 116th, and the 117th Congress did, and then also what our state has done and where we're at right now in terms of postpartum Medicaid expansion. So coming back to Kingdon, remember earlier in the class, I talked about the 3 streams, the policy stream, the problem stream, and the political stream. And here are the pictures of the streams. The problem is that the stream, there's a new focus on women's health with the Affordable Care Act. There's this focusing events with Kira and Shalon and Serena Williams. There's all this information coming from the policy stream related to widening disparities, increasing rates, Black women leaders begin to advance this issue. Groups like Sister Song and Black Mamas Matter begin to make this an issue at all the meetings that they go to. They start going to meetings where federal government officials are, like City Match and AMCHIP, Association of Maternal and Child Health Programs, APHA, and multiple solutions start being battered about, including the Medicaid expansion. In addition, the political stream happens because all of a sudden there's a recognition on the part of Democrats that Black women are driving the Democratic Party's majorities in this country, and the work of Black women is what's getting Democrats elected. So all of a sudden, Black women voters become a much more important constituency than historically they have been. And so that's the political stream. So opportunity lies ahead. So in the 115th Congress, there becomes, and there's so many acts, but there was Preventing Maternal Death Act of 2018. And this one was really focused on maternal mortality review committees and increasing the supply of maternal health providers in underserved areas. So nothing about postpartum Medicaid expansion. Then Congresswoman Lauren Underwood has the Black Maternal Health Omnibus. You see our Vice President, Kamala Harris, in this picture with a Representative Underwood. And we get this maternal omnibus, which is a legislation for every part of the federal bureaucracy, and does not pass, but it also does not include the postpartum Medicaid expansion. Then also in this Congress, the same Congress as Representative Robin Kelly introduces Moms Act to extend postpartum Medicaid, gives states the option to provide 1-year postpartum coverage under Medicaid and the Children's Health Insurance Program. And passed by the Congress, the House, sent to the Senate, not enacted in the last Congress. Then at the end of 2020, the federal government under Trump comes out with this initiative to improve maternal health and includes in it the Medicaid postpartum coverage option as a sample strategy. So you see all these things are starting to come together. Then 117th Congress, we have bills right away, Cory Booker and Menendez from New Jersey. They pass Maternal Health Awareness Day. Then there's the Newborn Act that passes, and the omnibus gets reintroduced. And so this is now back. This is all in the current Congress. So all of these bills, they cover many things, but one of the key provisions in many of them, not all of them, is this postpartum coverage option for states. Some of them have provider implicit bias training, some have medical care homes and care coordination, and some have social determinants of health focus, and some have innovative payment models and new ways to support, like centering pregnancy during prenatal care, that kind of thing. Well, the states, there's a lot of namby-pamby stuff going on here. Lots of bills being introduced. Come on, guys, get it together. Somebody pass something. So the House, of course, has been passing all these bills, but you get to the Senate side, and under Mitch McConnell, nothing was moving. And now we have more of a chance of things moving in this period. But the states weren't going to wait. So in 2018, the Illinois Maternal Morbidity and Mortality Report comes out from IDPH, and recommendation number 1, Illinois should expand Medicaid eligibility for the postpartum period from 60 days to 1 year. Then there's a coalition of people around this recommendation. So groups like Ever Thrive Illinois and March of Dimes and Schreiber Center begin to coalesce around this idea of postpartum Medicaid expansion. Then we have a progressive legislator, Robin Gable, who at the 11:59 at night, like when the budget's going in, slips into the budget some provision that says we're going to have a postpartum Medicaid expansion in Illinois with no money, but it's in there. So she gets it in there and boom, now we have it in there. How are we going to pay for it? So Illinois applies for a waiver from the federal government to extend Medicaid postpartum so that low-income postpartum women above the 138 that is now Medicaid coverage for in the Affordable Care Act can continue Medicaid coverage through 12 months postpartum. And this went to the Trump CMS, Center for Medicaid and Medicare Services, sat there. And there are 6 states in the same boat that have tried to get this waiver. And then the Illinois Maternal Health Strategic Plan. So we now have a new strategic plan for the state. This plan is a part of activity from I Promote Illinois and the Illinois Maternal Health Task Force. And it too asks for action step. Illinois Maternal Health Task Force members and our partners, I Promote staff, will continue to advocate for Illinois 12 months postpartum waiver for all postpartum persons on Medicaid. And that all postpartum persons is to include undocumented persons. The waiver that the feds that we applied for with the federal government does not include undocumented persons. And so we wanted to have a more inclusive effort here. And this is one of the things that EverThrive has been championing in particular. So now, okay, so the state, we couldn't really wait for the feds, so we moved ahead, but now it's happening again. So the states are really, waiting because now they're thinking, oh, maybe we won't need the waiver. The feds are moving. So the feds now in the reconciliation bill that passed the House, that's now in the Senate, includes the option for states to extend postpartum coverage to 12 months. So that's very exciting. And also there's a new act that our own senators, Durbin and Duckworth, introduced on February 24th, expanding Medicaid coverage to new moms' entire postpartum period for 1 year. So that is this incredible thing that we're all watching. So we're on 2 tracks now, the state and the federal track, and they're both moving. We'll see which one happens first. We're kind of hoping that the federal one happens so that we don't have to go through this waiver process. But then we'll continue to advocate for undocumented persons to receive that postpartum Medicaid coverage up through 12 months. So I'll end by just talking briefly about the kinds of tools you can use to, and I'll finish at 7, to communicate for policy and advocacy. And it's really important when you choose the tools you use to know your audience, know the message you want to deliver, match the message to your audience, and figure out the best strategies in terms of communication. So it might be the social media versus a letter to the editor, might serve you better depending on who you're trying to aim at. And it's really important to really understand who that stakeholder is and how they might perceive this issue. And it might be important to frame the issue, even if you have a certain vision, to respond to their framing in some way. Of course, it's not going to be exact, but to possibly, you want to move them on the issue. There's plenty of people who already agree with you. What you're trying to do with your information is move those who don't agree with you. What hook can you get to get them to engage them so that they are going to see this in a new light and say, that's the same case that happened to my daughter-in-law. She got off Medicaid at 60 days and she ended up being sick at 6 months and she had no coverage. Maybe I will pass this. Maybe I will support this. And just remembering that the communication tools you use are part of a dialogue between you and the stakeholders. And so I'm just going to say that you can do a variety of things. We do policy briefs. We do research syntheses and issue briefs. We do one-pagers that just sort of outline the issue, letters to the editor, op-eds, testimony, infographics, all kinds of tools that, I'm sure many of you are probably more adept at this than me, including, making memes, blogging, etc. And I'm just going to, this was just really discussing the difference between, research, a policy brief and a policy analysis, but we'll skip that. Just going to show you, the policy briefs that when to make them effective, they have to be just clearly describe the problem, be relevant, provide the evidence for the solution, give some recommendations, don't overwhelm with 20 million asks, and make them easy to read and visually appealing. So you sort of get in and get out. Here's the problem. Here's what needs to be done about it. These 3 states have already done it. Illinois can adopt it. Boom, we recommend that Illinois does this. All you have to do is this. And that's what that's how you get people. Otherwise, people are, overwhelmed with all your charts and your graphs. You could always put things in the appendix, send them follow-up information. You want to keep things simple so people will pay attention. And here's just a policy brief that I liked. A 1-pager is just a quick reference document. Testimony. One thing about testimony is that it's very helpful in testimony to tell a story. Often to start with, here's Leslie Ann, and this is what happened to her, and blah, blah, blah. This could be your daughter. This could be your partner. This could be your wife, whatever. That kind of thing does move people, especially if you're doing oral testimony. And people don't want to be preached at, and they don't want to hear when I grade students' papers, every fact and figure. It's boring. Try to make it so that, it moves them, tells them a story. What can they do to make sure that this doesn't happen again? You can give them the facts and figures later in an appendix. Just some infographics. Here's a COVID one that I liked. And so I'm just going to end by saying, when you want to do advocacy, taking the evidence and moving from evidence to information, that's one of the most critical steps of the entire process. Trying to gather the information, the data that's there, and turn that into evidence for action. And you have to have clear communication tools, and you have to make sure that you're trying to address those that you're trying to move. And finally, social and health policy really comes about from both the formal process, which is the levels of government, the branches of government, and this informal process of policy windows, policy entrepreneurs, being at the right place at the right time. It's almost like having to have connections, which is really terrible, but it feels like that sometimes, right? There are many ways to do this. There are lots of instruments you can choose. And to get policy change really is the interplay of evidence, social strategies, and political will. And I think political will is probably where people in school public health are most interested. And really, we have to fight to make sure that the policies that favor racial, social, and economic justice are the policies that get adopted and implemented in this country. So with that, I'll stop and I'll take more questions and comments. And I know there's a homework. Oh, no, I have the homework, the class exercise. Here it is. So you were supposed to be working ahead of time, thinking about food access, housing, environmental justice, disability justice, and medical education. And you're supposed to think about a policy change that you might want to see in any one of these groups. And then your exercise after your break is to really think about what's the policy instrument? Who do I, is this something that we're going to go for legislatively, administratively, or legal? What level of government? Should we try changing this at the city level, the state level, the federal level? Who are we trying to move? Who are key partners? What are some opportunities maybe that might make this relevant and be a good policy window? And what are some of the challenges that we might face in trying to get our policy adopted? And my contact information is here. And I'm always happy I respond to email pretty quickly. If I don't respond to you within 24 hours, it means I missed it completely. So I'm happy to take questions or comments, whatever you want to give me.
Well, first I wanted to say thank you so much. This was amazing. And I'm really glad that you're able to share all this information with us and that it generated a really amazing conversation because it's so relevant to now and past, present, and future, and how these policies kind of evolve and shift, and these, like you said, the windows of opportunity, and really encouraging us to seize those. So we do have about four questions. A few people on the discussion board asked, how does this kind of advocacy process vary from other countries? What is the role of the moral argument, and does that work? So I know I can give you an example. Canada's a confederacy. So they're not like us with an extremely centralized kind of core where the provinces, because they don't have states, they have provinces, have a lot more leeway and control over things as opposed to the states here. So how would a process like this, for instance, work there?
Well, I think that, you have to work within the context of your own structure, but that advocates probably work the same way. It's just that the levers are different. And you have to know, like here, there's a huge tension between federal and state. I don't really know in Canada, like if that federal province relationship is also problematic the way it is here. Here, it's like, it was set up to be problematic. So I can't speak to the structures of the other countries in terms of, parliaments, confederacies. But if you're an advocate, I mean, the whole idea of the policy process is going to be the same. Policy windows are going to be the same. Policy opportunities are going to be the same. You're just going to have to move it through differently depending on the structure of the government that you're in.
Thank you. The next one was how much, if at all, has the advocacy process changed in our now virtual context? I know you had touched on that a little bit, especially with memes. I love memes. But could you kind of talk about, for instance, the policy that we're talking about now? How would that be? How has that changed because we're now in a virtual age? Like, how does the advocacy for that change now?
I think things are just faster. Things just happen so much faster, and there's so much faster communication, and you can get so much more support quickly because we are all connected. I just, having done this since, probably since I got to Chicago, since '77, it's just so different. We used to, I have all these files, and I look. I guess I was very boring. I used to write speeches. I have these handwritten speeches that I would write about this or that. It was usually about reproductive rights. And then, I write speeches, and then there'd be a speakers bureau, and we try to get somebody to have us come talk about the issue. And it was laborious. I'm not kidding. And it's so much easier and faster. Maybe we're doing less, direct education. And that was good that we were trying to do speakers, but we literally were trying to get all kinds of community organizations to get us to come speak about our issue. And I think maybe we were more in touch, but things were so slow. Things are so much faster now, for good or for bad. I mean, things just move because there's so much more open communication.
The third one, which is really interesting because there's actually a new awareness day that I'll mention in a second, but do you think awareness days and months are a useful aspect of policy? For instance, there's actually an awareness day for assistive technology. It's fairly new. It's I want to say a few years old. But some people who are in assistive technology, they're like, oh, this is great. This is our opportunity to remind people year after year about AT. But do you think that has an impact on policy?
I think the problem with it is that we're getting to be, every day is a different awareness. And also, we have this month, that month, and, prematurity week and mortality week and teen pregnancy week. And I do think the idea of it is good, but I feel like people tune it out some, I feel like there's some tuning out. What it does help is that it helps the advocates mobilize, that even if they're being complacent for a while, at least gets them going again and make sure that their issues are out there. On the receiving end, I do think that there might be some kind of, it's just so much coming at you, and you sort of, I think there's some more tuning out than we think, unless there's a very specific thing that needs to be addressed, So it's good to use those for a very specific, for specific changes that you want, and not just generalization.
And our last question, which I thought was heavy, was how do you stay motivated and keep pushing your policy when it keeps getting sidelined, especially when you know that women can die without coverage after postpartum?
Well, yeah. How do you play the long game? Well, I guess it's working with great people and working with great colleagues that really keeps everybody going. And just, you don't do it by yourself, and you're doing it with incredible people that also have, whoever's down, somebody else is up that time. And also just things, I have seen things change. I mean, I have seen policies adopted. I've also seen horrible things, taken, like, the last 4 years, that so many things, there were so many setbacks, but I don't know. I don't think I could live with myself if I didn't keep fighting every day, to do the things that I think are important. And some people just decide it's too much and it's exhausting and to tune out. So there is a very importance of self-care when you're in this. I think we're all put together differently. For me, being an advocate and doing policy work is just sort of like, so who I am, like, it's like part of my nature. I think for other people, it sometimes can be really stressful, and you might have to, step back more than I step back. But I don't get discouraged. I actually feel like if I don't fight, if we don't fight, we're not going to get what we want. We have so many things to fight about, and we're just going to get shut down. And I also have to keep myself, I have to like remind myself that, okay, people, we have this terrible things I think to myself, but like, okay, with these 9 judges, and this is this, and this one might have a heart attack, and this one might get cancer. I just like talk myself into it, it's like, okay, it's not forever, even though we think it's forever, things happen to people, so like, okay, we can't, I just like try to like psych myself, because otherwise I really could get discouraged, because right now the Supreme Court is the most discouraging thing going on in this country, the courts, and it's very disheartening. I mean, I'm really scared about the voting rights, and but I think, okay, it's not forever. Something's going to happen. Some other change is going to take place. And like, we just have to be there, be ready.
Yeah, thank you so much. That was a really great to kind of end on. So thank you again. I'm going to just
okay.
do a little round of applause.
Thank you so much, Dr. Handler.
Thank you. And I see some of my friends are here. I see LaShonda's here. Oh, there she is. Okay.
Thank you. So for the students, we will go into our breakout groups now with the ones that we put together on Blackboard. So I'll set up a breakout room with the title of your group name, and you can just join it when you get a chance. So we'll take a really quick break. Come be in your breakout room by 7:10. And then we'll just end the class in the breakout rooms doing the activity, which is also posted to Blackboard. Thank you so much, Dr. Handler.
Hey, adios. Thank you.
Thank
Bye.
you.